Hi, my name is Orion Farr. I'm a 19-year-old student at Rutgers University studying pre-med, and I have a condition called Pectus Carinatum, which is characterized by a protrusion of a cartilage out of the chest.
Pectus Carinatum is one form of a pectus deformity, which is actually quite common. Pectus deformities occur in about 1 in every 400 to 500 children. It's very common that it becomes more symptomatic or noticeable as people go through adolescence due to their rapid growth spurt.
As I was growing, I noticed my chest was growing along with it, and as I got older, the prominence of the protrusion became more apparent.
Pectus carinatum is also known as pigeon breast. What people will see is that their breastbone or chest sticks outwards as opposed to inwards. It's also very common that people will notice sticking out of the ribs and maybe even an imbalance between sides of the ribs with one side sticking out more than the other.
I first recognized that I had a problem with my chest when I was a sophomore in high school. My friends in the locker room would point out that my chest looked weird and things was protruding out slightly bit, but at that point it wasn't very prominent, so I didn't worry about it too much. I thought it was my body naturally growing as I was maturing. But as the years went on, about my junior year, I realized it was very significant growth on my chest, and that's when I asked my parents about it, when we began this search into looking for a doctor to help treat it.
Most people who come to see me do have significant symptoms because most of the people that come have moderate to severe chest wall deformation. These people generally have significant shortness of breath, especially with sports. It tends to occur most commonly in people who have gone through a growth spurt, so it's young adults, people who are of adolescent age, maybe in high school. They begin to notice things that are changing with their body, and they're not really sure what to do about it. Oftentimes in the more severe cases, they'll complain that they just can't keep up with their classmates. They're active and they're fully healthy, but they just don't have the endurance or stamina that some of their friends do. A common treatment for pectus carinatum is wearing an external brace that you wear for about 14 hours a day, and you wear it over clothes and it applies pressure to the chest, and it has to be worn for about 2 years. That's best for people who are still growing and have very flexible chests. But many people who come to see us find that wearing a brace is uncomfortable or just doesn't fit into their active lifestyles, and they'd like to have a therapy that they can have done in a shorter period of time and get the best outcome possible. And so many people are interested in surgical repair.
First I was wary if surgery was the right choice for me, but after meeting Dr. Kaufman, I felt confident in his abilities to help me with my problem and the surgery that would follow after it.
We spent a lot of time together learning about what we could do together as a team. His family was very involved in the decision-making process, and together we came to the conclusion that for him, surgery was the best option. Surgery was so successful in restoring not only normal function, but a normal appearance to Orion.
Overall, the experience that I've had at Mount Sinai was a very positive one, since the fact that my surgery helped me feel more comfortable with my body. The relationship I fostered with Dr. Kaufman and the Mount Sinai staff helped me have a greater interest in medicine, and even led me into shadowing some of his surgeries and seeing the operating room from the other side.
I've been so thrilled to watch him develop into such a confident young man. He's come back to Mount Sinai where he's volunteered and done research with us. He's come to the operating room with me to observe what we do as thoracic surgeons, and the mentorship and relationship is ongoing, and that's really very fulfilling. It's something that we don't always get to do with people, but it's something I love about Pectus, is that it's an ongoing relationship where we can help people for a long period of time and help them be the people they want to be.